And may I request now Dr. Rameshwaram Sharma to chair the next session. Dr. Rameshwaram Sharma is currently the Chief of Department of Radiation Oncology in SMS Medical College Hospital in Jaipur. SMS Medical College is one of the oldest and alma mater for most of people sitting here in the audience as doctors. Along with him, Dr. Surendra Beniwal. He is professor in the Department of Medical College. He is attached to Acharya Tulsi Cancer Center, which is a regional cancer center in Rajasthan, catering almost half of the population of cancer patients in Rajasthan. So with these kind words, may I request Dr. Rameshwaram to please start the next session, please.
Thanks, Dr. Lalit, for giving me opportunity to chair the session. The next topic is food and fluid during and after chemo and radiotherapy. And this will be discussed by Emily Engstrom from USA.
All right, so we'll get right into this, nutrition and hydration during and after chemo and radiation. So some of the common side effects from patients who are receiving chemo and radiation, specifically when they're receiving them together, is that can be an increase in side effects. We can see nausea, vomiting, diarrhea, fatigue, mucosal changes, and skin changes. And it all depends on the areas that are being treated, the type of radiation that's being used, the type of chemotherapies that are being used, and what the exact protocols are that are being given. So we have to take all of that into consideration and think about that when we're taking care of our patients. As far as hydration goes, the standards for hydration are about 10 8-ounce glasses of fluids per day. I know that most of us, especially those of us in the healthcare field, do not get 10 8-ounce glasses of fluids a day. But we do try and recommend that for our patients as much as possible. We want them to stay hydrated. If they can keep their cells well hydrated, this will help them through the course of their treatment. Their body will be able to heal and repair much more rapidly. We recommend that they avoid alcohol and caffeine as much as possible. We certainly do not tell our patients that they cannot have these things, but we tell them that we want them to have them rarely or at least very moderately, as these do have a diuretic effect, and we certainly don't want to lose any more fluids than we have to. Fluids that do contain electrolytes can be helpful during periods of diarrhea and vomiting. Patients who are able to even just keep down small sips of water, if they can keep down a few teaspoons of water every 30 minutes, if they can continue to keep taking down 5 to 10 milliliters of water, then they can stay hydrated throughout the day, but they have to be consistent and they have to continue to do that. Those electrolyte containing products can help, and we can talk about that. We mentioned coconut oil. Coconut water is a great natural electrolyte containing fluid, and that's a great product that doesn't have a lot of extra sugar, that can also be dehydrating for these patients. Patients receiving chemo and radiation may not feel that thirst, and so it's important for them to really be aware, cognizant of continuously taking in fluids. We will recommend to our patients that they keep a refillable water bottle with them, and be aware of how much fluid they're actually drinking throughout the day, because they just don't notice. They may be nauseated and not wanting to drink, and so they think they're getting enough, but in actuality they're not. And in fact, dehydration can increase that nausea feeling as well, so we want to be aware of that. As far as nutrition goes, a well-balanced diet with plenty of carbohydrates and proteins are really going to get patients through this course of treatment. It's going to allow the body to have all of the building blocks that it needs to heal and repair healthy cells. Fruits and vegetables are a great source of high quality carbohydrates. We certainly recommend staying away from processed foods. If we can stay with some good, natural, healthy foods, that's best. Legumes, nuts, and seeds contain high quality proteins and actually tend to be better tolerated by the gut as opposed to animal type proteins when their gut is in distress. Many of the animal proteins can cause inflammation in the gut. And so using more plant-based high quality proteins is something that many areas are looking at and finding that's very helpful for patients. And again, it's better tolerated. Patients can eat smaller amounts more frequently. They can digest it more readily and easily and get a better use of the proteins that they can receive. Our patients work with dietitians that are specially trained in oncology, and they will go over all of this with our patients and help them come up with a plan specifically for them, specifically based on the type of treatment they're having, specifically on what their dietary needs are. And so that's very important. But I think the takeaway from all of this is that if we just encourage our patients to get those good carbohydrates, to get those good proteins, their bodies will be able to do what they need to do to help them heal and repair through the course of their treatment. Some tips that we provide for our patients, knowing that their taste may change depending on the type of treatment that they're receiving, whether it's radiation to the head and neck, or whether it's a type of chemotherapy that's affecting their taste, altering their taste buds. One of the things we say is that your favorite foods are not going to taste the same. We try and tell patients that as soon as that starts happening, it's best to stay away from those foods so that they don't then have an aversion to the foods once all the treatment's complete. We want them to have something to go back to that's going to bring them joy and happiness. And so we don't want them to create an aversion. So we'll tell them to start trying other things, figuring out what they can tolerate, what's palatable, and keeping in mind that this is going to all get better and those things are going to get back to normal. Your body's going to heal and repair, but it's important to just get through this point. If patients are nauseated many times, I know that all of us want to cook for those who are not feeling well. We want to feed them. It does something for us to help them feel better. But if we're cooking where those patients are, many times it makes them feel more nauseated and we can start a vomiting cycle. So we try and recommend that if someone wants to cook for the patient, that they can maybe cook somewhere where the patient in another home, somewhere close by, and that can help prevent a lot of the excess smell that can cause an increase in the nausea. Cool or room temperature foods tend to be well tolerated or better tolerated by patients who are experiencing nausea. So that's another tip we provide for patients. They just have to work with it and see what's helpful for them. And again, I really can't stress enough that those proteins, especially those plant-based proteins and the fluids are really essential for the body to repair and rebuild all of those normal healthy cells throughout the course of treatment. The damage that's done by the radiation to the cancer cells and to any abnormal cells is good. We want those to die off and go away, but we want our normal healthy cells to repair and rebuild. So this is where that comes into play, and this will help provide those building blocks to do that. So that's what we have for nutrition. What can I answer for you? What questions do you have about how we manage this? Oh, I see a question in the chat box about ginger and nausea, and I'm glad you brought that up because ginger is a wonderful, wonderful option for treating nausea. Many patients find, and we recommend real ginger, not ginger candies or ginger ale, because ginger ale is mostly high fructose corn syrup. It's not helpful. There's not much actual ginger in it, if there is any, in most, at least here in the US. But ginger is a wonderful natural substance that does seem to show some benefit in many patients. We don't have a lot of studies in that. One study that we just did here in our institution actually is around peppermint oil and patients who are having nausea during chemotherapy. And we use peppermint oil on a cool washcloth and place that on the patient's neck while they're receiving chemotherapy or when they're having episodes of nausea. We actually found that patients had a really good response. It's something natural and simple that can be done for these patients, no side effects, and it's a wonderful benefit. They can do it as often as they want, and it works really well. Any other questions?
Thanks for the nice presentation. Our food and fluid during chemo and radiation therapy, because it's very important for normal tissue to heal after radiation and chemo. So fluid and proteins are very important.
Sir, can you allow me for one question to Emily?
Absolutely.
Yeah, thank you so much, Emily. So wanted to know about any modifications during the neutropenia phase of post-chemo, post-radiation. Do you have any issues about the fresh fruits, vegetables, salads, anything you stop that or you continue that?
So at least here, we use quite a few medications to help with neutropenia, and we don't see the issues that we used to. You know, when I've been doing this for over 20 years now, and when I started in this field, we did with fresh fruits and vegetables. We had to really be careful when patients were neutropenic. Now, our patients just receiving routine chemotherapy and radiation, we don't see those neutropenias. We're able to treat them if they do come up. So the only time we really deal with that on a regular basis has to do with our bone marrow transplant patients. And that's when we have more issues and we have to watch that. But then those patients can have cooked vegetables and fruits, and they do well with that. Just so that they're cooked enough to kill off any bacteria or fungus that may be hanging out in those fresh fruits and vegetables.
Thank you. Thank you so much.
Absolutely.
Thanks, Emily.
Thank you.